So I'd like to welcome everyone in the room and everyone who's joining us online. We're delighted that you can join us for the first of the Cabot Institute for the Environment and the Elizabeth Blackwell Institute for Health Researchers' first Climate Change and Health seminar. We're going to have two talks from two fantastic academics. Then there'll be 15 to 20 minutes at the end of the seminar for questions. Anyone who's joining us online can ask questions using the question and answer feature on the webinar. And for those in the room, please do join us for tea, coffee and refreshments, which you can see at the back after the seminar. So I'm going to introduce our two speakers today. Dr. Ailish Craig is a research associate currently investigating sustainable development and climate adaptation in Southern Africa. Eilish's current research explores the use of climate information in national decision-making in the Southern African region. And broadly, her research has two key strands: how climate science is utilised within the adaptation planning process, and drawing on risk communications literature to test and develop evidence-informed methods of communication for improved comprehension. Her title is How Climate Science is Not, brackets, used in national adaptation planning in Southern Africa. Relevance for the health. We also have Leticia Marca, who is a Brazilian PhD student working here at the University of Bristol in our population health sciences department. During her career, she has worked with environmental education and epidemiological research, which has helped her to build a comprehension into how the environment is connected with human health. And this has led to her current research, which focuses on how local actions and decision-making contribute to mitigation and adaptation to climate change and its impacts on health and vulnerable groups. And Leticia's title is going to be focused on how health and vulnerable groups are considered in local government climate change action planning, a document analysis of local climate change action plans and strategies. So, with no further ado, I'd like to hand over to Dr. Ailish Craig, who's going to join us for the first of our two talks.
Hi, thank you for the introduction. I'm Ailish Craig, postdoc in the School of Geographical Sciences, and I'll be coming from this problem kind of from the climate side. And so I'll be looking at how climate science is used in national adaptation planning processes across sectors and across countries in Southern Africa. But there is a lot of relevance for the health sector, and so health came up quite a bit in this work. So, some of it's broader, and then I kind of narrow down into the health relevance. So, I'm sure many people know the climate adaptation planning comes in very many forms. So, individual to household level, all the way up to national and international. And the focus of the project is on this national level. At this level, the requirements and use for climate projections really vary, and the guidelines of what needs to be included varies, and what that actually looks like differs. And of course, climate science is very complex, but so is adaptation. And so when you put two of these complex things together, it gets quite confusing at times. And in this region, the Southern African rainfall in the climate science is really uncertain. So some of these models are suggesting a wetter future, some a drier future. So of course, when you're a decision maker, how do you use that? And I'm not from the adaptation planning kind of space, but there's all these things: political cycles, government ownership, length of projects and research, governance, financial capacity, that also have a part to play in adaptation. And so there remains what we call a usability gap. So what scientists provide or are able to provide, and what decision makers need or think that they need, it's not being met. And there's this, let's get rid of okay. This envelope of uncertainty by will be in Desai, and ultimately there's so much uncertainty before the adaptation part of it that it all builds up. So future society, how many people will be on the planet, greenhouse gases, what will mitigation look like, how much emissions will there actually be. The climate models, no model is perfect, and so they have uncertainty with them, all the way down to these adaptation responses. And so the relevance for the health sector is, well, great timing. Last month, the WHO approved their Global Action Plan on Climate Change and Health. So this was going to have a real focus on the two concepts. And I've underlined here some of the key parts I think this research is relevant for. So developing climate resilient health systems, early warning and vulnerable populations. And then there's also the integrating health into climate policy. And this works almost looks at it from the reverse. How is climate integrated into policy at the adaptation level and in different sectors? And so this question is already being asked, but I suspect it will be getting asked even more, is how can my country's health sector adapt to climate change? A very relevant question, but not necessarily an easy one to answer. And so there could be a lot of scientists who are providing information that they've maybe analysed a little differently, they communicate a little differently. There's, the government policies and decisions that they have to consider, online information, and, their own beliefs and knowledge as well. And all of these will be feeding in, and it can get a little bit complicated, especially with such uncertain science. So we came up with these kind of three questions, which the first one is very kind of simple. What climate projections are being used currently in these adaptation planning processes? And how is the uncertainty represented, interpreted and communicated? And when I say uncertainty, I'm talking about climate projection uncertainty. And how are they actually used? How do they inform national adaptation planning processes? A very quick overview of the method. So it's a document analysis and interviews. So these documents, all 16 countries in the Southern African Development Community, so that's roughly the DRC and Tanzania South, have these documents, and they submit them to the UNFCCC, and they have their adaptation options and their mitigation and emissions targets and working towards those. Of course, it's hard to get lots of depth from a document analysis, so there's also interviews with a range of people, including climate scientists, government people, technical experts, and people from boundary organisations, so they're kind of impact modelers or applied researchers. And very broadly, the sectors that they include in these national communications are kind of up to them, but health is in all of them, which is great. And there's some evidence that the climate science that's been used over time compared to another study is getting better. But at the same time, the number of models and the number of emission scenarios in some of these reports are not sufficient. And the jury's still out on what a great, robust climate projection looks like. But broadly, having multiple scenarios and a large ensemble, so by a large ensemble, I mean a large number of models, is kind of a stepping stone. And some of these reports use just one model or one emission scenario. And then when looking at the uncertainty and kind of talking about it more explicitly, only half of the reports really had that in, and there was limited intermodal uncertainty recognised. The other key thing that I think is very relevant to the health sector in particular is I looked at what projections, what variables were projected. So we've got temperature here, precipitation here, rainfall here. At the top, we have the annual averages in total, so annual amount of rainfall, their average temperature. But of course, we have variations, and things like extreme rainfall, heat waves, they're the things that are causing the impact, but they're not projected, and there's lots of climate science reasons for that, but it can be analysed, and you can see there's less than kind of 5 for some of those included in the reports. And yeah, so these annual variables kind of mask the extremes that have the biggest impact on health sectors and hospital admissions. One of the climate scientists that I spoke with, they said, we didn't actually find a trend in terms of total annual rainfall, but when the trends that we did find were in what we call extreme rainfall indices. So yeah, kind of picking down into the variables is potentially something that needs to be done. I apologise for the climate scientist, anyone who's not a climate scientist in the room. I'll talk through this, but it's effectively showing mean rainfall change, and that is done by my colleague Alan. It's in review. So we have months of the year along here, and then the y-axis we have end of century change, and that black line there is the baseline period. So the historical present climatology that this end of century projection is compared to. The red and blue are all the individual climate models. So above the line is suggesting a wetting, and below it's a drying. So you can see why having multiple models is key. You know, if you pick, say, this one, this one, this one, it's telling a completely different story to one at the top. And also why it's important to not just look at annual, because you mask that variation. And I think that paper should be out soon for anyone interested. And so how are the climate projections actually used in this planning process? Kind of previous literature showed that seasonal and weather timescales were used the most. So what about this climate timescale? And the good news is it is being used in various ways. So at that far end on your left, we have kind of context setting, looking at the future climate, and then going from there, jumping off there. It's also a starting point for designing adaptation and prioritising different adaptation options as well. So really being informed by the climate projections there. And this was the case for the national communications and some other national documents that go into the UNFCCC. Then the justification of these improved, of the justification and improvement of adaptation. So people will have their adaptation options and then use the new science to justify, should we still be on this track? Do we need to make any changes? Because of course they don't happen overnight. And then we had also accessing funding for implementing adaptation projects and justifying some projects kind of as a tick box exercise, which is obviously not necessarily what we want. But in the national communications, the document, there was a stronger link between the adaptation and the vulnerability and the impact rather than the projections. Now, this is fine if the vulnerability or impact analysis has the future climate projections in them, but in a lot of cases it doesn't. And in that case, they are then planning for making adaptation plans for current issues or even past issues. Another big thing is to focus on a key event. So the 2015-2017 drought in the Southern African region was noted quite a lot. And then in terms of some of the barriers to climate information, it's probably no shock that the communication of it is really hard and it's quite hard to understand. And so that came up. One of my interviewees said, you know, those IPCC graphs, the graphs that are for policymakers often are really hard to understand. I don't understand them at all. But it's also the flow of information as it's, you know, passed on, it changes, and even the awareness of some of the science that's available. Then if we go on to the climate science uncertainty, how climate scientists represent and communicate this, it varies quite a lot. I won't go through all of these, but these are some of the different methods of communicating. So stippling and cross-hatching of maps. So this is an example. You can see the dots and the hash at the bottom there, and that will signify areas where there's agreement or areas where there's no agreement in the models. But the person, a few people were saying that people don't understand that actually. Simplifying language using past analogues. So, okay, the 2003 heat wave in the UK, do you remember that? The impacts it had, that will become X times more likely in the future. Alternative scenarios, and then using the multimodal distribution, so the upper, lower, and median. But of course, that requires a good understanding of probabilities. And then in terms of the health sector, it came up in quite a few countries, actually, of the people that I spoke with, that the health sector feels a bit more removed compared to other sectors, which of course makes sense. And so these are a few of the quotes. So this government official person said, I won't read it all out, but they said, the climate change, know about that climate projection study, but there's some sectors, I think health doesn't know about that study. So they were saying there were plans happening and they weren't aware of this climate change study that agriculture had used. Here, you know, and they said building capacity of maybe health personnel, where they'll be able to see climate change and health. People are able to link infrastructure and climate change. People are able to link water and climate change. And similarly, so scientists that are working with governments already, they said, oh, our colleagues from Minister of Health and the National Institute of Health, they were not, let's say, knowledgeable about climate data and the format it came in. And then finally, this was an applied researcher, I believe, and they said there was a gap in terms of climate change and health, and they've been making some noise in my country. And so it came down to how I've kind of conceptualized this is interaction, interpretation, and integration. And so having this collaborative process of building these plans and integrating the science from the interviewees, it seemed to have the outcome was really well understood government-owned adaptation plans. And then through that interaction, you've got better interpretation of the science, what it means for the sectors, and then going into the integration of it actually being used. And that makes sense because obviously you're not going to use something you don't understand in your work. And then leaning on a typology of interactions that was conceptualized a couple of years ago about users and providers, ultimately it gets the off the peg is quite limited interaction down to bespoke, which is more about co-production and mutual learning. There were evidence of all of them. So, you know, very quickly get a consultant on board within a week. They'll have very little influence on how the project got designed. Then there was this one. They involve the policymakers from national level up to grassroots. We want to work with them from the start of the project until the start of implementing, monitoring and evaluation. We do everything together until the very end. And here this person was comparing two different documents. And they said, you know, this was done by country experts and not a consultant. So there was further buy-in, they were doing multiple documents, they had a really good understanding of the sector and their country. So if I quickly wrap up, from a science point of view, from a climate science point of view, you know, there needs to be a bit more focus on the number of models and scenarios used and representation of uncertainty and this over-reliance on average means. And also be aware that some of the adaptation that's been done is informed by current issues or recent issues that have happened rather than future climate risk. And that could mean that emerging risks are not considered. And there's a lot of evidence for collaborative processes. And there's a lot of amazing involvement in meetings and work going on as well. But the interpretation of these climate projections is really key. And so just the projections on their own won't necessarily overcome some of these barriers. And I think the health sector can really learn from previous sectors that have already gone through this process and can learn from some of the great collaborations that are happening. And very quickly, because I'm running out of time, recently was at a workshop for the Cascade project in 4 different countries in Africa. It's about climate and health in African cities. And they do this collaborative process super well. It's really impressive. And they have these learning labs, basically, and it's about bringing everyone together, and learning, addressing the complexity, not shying away from the complexity, and bringing lots of people in. And this one was in Harare in Zimbabwe. First learning lab, they identified the burning issues. That was done by the people in the room, not the researchers. And then we built this risk pathway based on the burning issues, which was cholera, waste, and rainfall. And there were a huge range of people in attendance, from private companies, city management, students, researchers, community empowerment groups. Luckily had the government finance class in there as well, which is always very important, and built this map out of how does everything link up, where does climate come in, because some of the people in the room really couldn't contextualize climate and health together. It was quite far removed from them, and I think at the end they could build it up, and I think the next learning lab will add even more climate. So it's done over a 3-year period really. So that's a bit of an example, because I know it's quite hard to try and think of what that looks like. I will stop there. The main part of this presentation is in a carbon brief, and the paper's out. And if anyone would like to know more about the Salient project, which is the main one, we have a website. It's a QR code, and thanks to all the lovely co-authors who helped with this work as well.
Hey everyone, my name is Leticia, and today I'd like to share with you some results that I got on my study about how health and vulnerable groups are covered in climate action. Before that, I would like to take a step back and talk briefly about the causes and consequences of change. So the sun emits energy to Earth, and then Earth absorbs this energy, warm up, and reflect it in the form of heat. Part of this heat is kept on Earth because of the greenhouse gases. So these gases are extremely important for life on Earth, as we know, because without them, the temperatures here would be extremely cold. However, due to human activities and our dependence on fossil fuels, the concentration of these gases has increased, which leads to more heat being trapped on the atmosphere, which is one of the main causes of climate change. Additionally to that, because of the combustion of fossil fuels, our air quality can suffer with that, which can lead to health problems for humans, especially on the respiratory system. But climate change itself can also have major consequences that can lead to health problems. So due to climate change, we can see the global temperature increase, which leads to ice melting and by consequences, sea level rise, more intense heat waves, especially in urban settings where the majority of the population is living, also changes in rain pattern, leading for flooding events in some areas where other areas experience drought periods, and also more intense and frequent wildfires and extreme weather events. So all these consequences can have direct or indirect impacts on human health. For example, warmer temperatures can lead to cardiovascular systems problems, more intense, more frequent heat strokes and heart attacks. They also can change the geographical distribution of vector-borne disease like dengue and malaria, because due to warmer temperatures, mosquitoes now can live and survive in areas where in the past they could not because the temperatures there were too cold. Additionally, changes in rain pattern can also contribute to that, because it can contribute to the reproduction of the mosquitoes and help with the dissemination of this disease. Changes in rain pattern can also compromise food production, which can lead to nutritional problems for human health. Additionally, it can also contribute to the problems related to food security, which can lead people to forced migration, and that can lead to problems in mental health. Similarly, sea level rise and the growing intensity and frequency of extreme weather events can also cause long-term mental health problems for humans. Therefore, climate change is not only an environmental problem, but also a big public health challenge. And some groups are more vulnerable for these consequences. So children, for example, are still developing their immune system, which makes them more sensible for air pollution and hot temperatures. Older people have bigger problems to cope with extreme heat and cold weather. Pregnant women are at higher risk of heat exhaustion, and due to climate stress, they are also have more chances to deliver preterm birth. People with low income or marginalized communities have low resources to face climate change. So when we talk about climate change, there is also a big discussion about climate justice, which is basically how climate change can have an unequal impact in local areas and across the globe. So some of those who contributed less to it suffered the highest impact. So for example, high-income nations historically contributed more to the current levels of greenhouse gas emissions, but it is expected that low and middle-income nations are the ones who suffer the biggest impact once they have less resources to be prepared for it. Therefore, climate change can exacerbate both local and global inequalities and vulnerabilities. So in order to face climate change, local action must be taken by local governments and local authorities. And these actions can be related to mitigation, when they aim to reduce greenhouse gas emissions, or adaptation, when they aim to prepare the local area for the inevitable impacts of climate change. So local authorities and local governments have a fundamental role to play because they can have the key influence the local emissions, and they are also responsible for managing some key sectors like transport, water, waste, land use, and built environment. In order to guide their actions, they can elaborate climate action plans, which contain actions and goals related to reducing greenhouse gas emissions, and also how to improve local resilience. These plans can act as guides for the local actions and decisions, and they endorse the local commitment to climate mitigation and adaptation. And this document is where my study focused. So, in my study, I aim to understand how health inequalities and vulnerable groups were covered in climate change action plans. And since climate change can have a different impact across the globe, I selected unitary authorities in southwest of England as an example of a high-income country and Brazilian state capitals as an example of middle-income country. So here are some results that I have. In southwest of England, we have 12 unitary authorities. Among that, 11 have climate change action plans. In Brazil, we have 26 state capitals, but only 10 of them have this kind of documents, which shows that there is still a lot of work to be done in Brazil in relation to the elaboration of these documents. There is also a difference between the target year each area aims to achieve carbon neutrality. So in southwest of England, the target year is 2030, while in Brazilian state capitals is 2050. That can be related to the financial costs involved in becoming carbon neutral. 5 out of 11 documents in southwest of England and 9 out of 10 documents in Brazilian state capitals have emission reduction scenarios, which is something very important because it shows how local emissions will be in the future if no climate action is taken in comparison if actions are taken. So it can be used as an explanation and a reason why climate mitigation actions should take place. All documents from both country areas had emission inventory by sectors, which is also very important because it's analyzed to the local authorities, which are the key sectors they need to work with in order to reduce their emissions. 8 out of 11 documents in the southwest of England and 8 out of 10 in Brazil discuss about the causes of climate change documents. And 8 out of 11 documents in southwest of England and all Brazilian documents discuss about the local climate change impacts. So they discuss which are the major threats and risks for their local area, which is important because it can help them to guide their actions in order to increase their local resilience and be more prepared for the climate impacts. All the documents in southwest of England and almost all of the Brazilian ones discuss about local actions, so they are aware of the importance of local actions taking measures to face climate change. And almost all of the documents in both country areas discuss about the co-benefits of climate action. So they discuss that by taking actions to mitigate and adapt to climate change, this can also bring benefits to other areas and sectors, which can help people be more willing to commit with climate action and also can facilitate the resources for implementing local action. All the documents from both country areas had plans related to renewable energy, energy efficiency, transport, natural resources, land use, built environment, and communication and educational sectors. But there are also some differences. So for example, in Brazil, all the documents have plans related to food and agriculture, water, and waste sectors, which also appear in southwest of England documents, but not in all of them. On the other hand, on the southwest of England, almost all the documents have actions related to heat and cooling, which was not present in Brazilian documents. These differences can be related to the local characteristics and current challenges these areas face. So for example, in southwest of England, there is a concern with being prepared for the cold temperature during the winter, which is not a main challenge for the Brazilian state capitals. When it comes about health, so all documents from both country areas discuss that climate change will have a health impact. However, how health is discussed across these documents is a little different between the country areas. So for example, in southwest of England, all the documents discuss that transport can have an impact on health. That could be because on the literature, there's a lot of evidence that transport can interfere in air quality, which can lead to health issues. The second main discussion on health in southwest of England documents is related to natural resources, which also appear in a lot of Brazilian documents. And again, this can be related to the fact that in the literature, there's a lot of evidence suggesting the benefits of nature and green spaces for human health. On Brazilian documents, we can see that all of them discuss about how water can have an impact on health, and that could be related to the fact that in the country, there's still people who lack access to sanitation and clean water. Also, in Brazilian documents, they highlight the link between waste management and health, and these two sectors combined, water and waste, can have major impacts on vector-borne disease, which are health impacts that are current concerns for Brazil and are expected to get worse under climate change scenarios. When it comes about vulnerabilities, all Brazilian documents discuss about climate justice and local inequalities and vulnerabilities, which are also present in the southwest of England documents, but not in all of them. I also try to understand how they discuss how environmental management can lead to environmental hazards. So for example, if they discuss how poor housing infrastructure can lead to more climate vulnerability, or how the use of some materials in buildings can increase or decrease temperatures. This discussion appears in 3 documents in southwest of England and all Brazilian one. When it comes about land use, so for example, if they discuss how changes in soil use can change soil permeability and lead to flooding events, these appear in 4 documents from southwest of England and all Brazilian ones. When it comes about natural resources, if they discuss, for example, how green areas can help to prevent flooding and decrease temperatures, these appear in 7 documents in southwest of England and all Brazilian ones. When it comes about water, if they discuss, for example, how canalized water courses can lead to flooding events, these appear in 7 documents from southwest of England and all Brazilian ones. And finally, when they discuss waste, so for example, if they discuss how problems in waste management can lead to flooding events and dissemination of disease, these appear in 1 document in southwest of England and 7 in Brazilian state capital. So this is the overall results when it comes about the discussion about environmental management and is associated to hazard events. And we can see that in Brazil, this discussion is more present than in the documents from southwest of England. And that could be related to the fact that in Brazil, there are many urban slum areas. So there are people living with poor housing infrastructure, sometimes risk areas. So for example, next to hillsides, problems to get access to sanitation and clean water and waste management. In conclusion, these country areas share some similarities and some differences. These differences can reflect the local challenges and the local characteristics, but the similarities and differences that we identify can be used as learning tools on how local areas can mitigate and improve their local resilience. Thank you.
Very much. I'd like to invite Ailish back to the stage, and the stage sounds very dramatic, and there's an opportunity for questions. So I'm going to be manning the questions that are coming in online. Those of you who are joining us online, please do add your conversations to the chat, and Rebecca is going to be taking questions from the floor. So any questions?
Hi, can I ask a question to Leticia? I was interested, could you say a bit more about the point on heating and cooling? I think you said it was included more in southwest England than in Brazil, whereas I know in parts of Brazil there's already a lot of air conditioning use. So I thought like kind of thinking about heat and management of heat would be a big issue.
Yeah, you're right, but still the majority of documents in Brazil don't really focus on that part, which is a gap that they need to fill, how they can make places better with, especially when you consider indoor temperatures under climate change. But this is a gap there, and this is more explored in the UK, even though in the UK also the strategies mainly focus on how being more prepared for the winters and the impacts of that in relation to climate change.
So I had a question for you both about the intersections that you might have observed during these talks between your two areas of focus. We've had a sort of really interesting focus on the plans themselves, and also a really interesting focus on perhaps the limitations of how data can be accessed in informing those plans. And I wonder whether there are any solutions to perhaps that data integration question that have come up on hearing each other's talks today.
Yeah, that's a good question, a hard question. I think, I mean, firstly, I'd be really interested to know what the climate change impacts look like for Brazil, and see what they're like. I think part of, I don't like to say problem because there's so much great work going on, and some of these documents are like 200-300 pages long, so they're huge and take a long time to put together. But one of the things that I think is key is like the siloed way that it's done. So in one of the quotes, they said about, you know, infrastructure and climate change is really well linked. Infrastructure and water is really well linked. In the Southern African context, health is linked with water and health linked with infrastructure. In the way that you suggested about this kind of informal settlements as well. And so it's potentially there could be more crossover, but it's very difficult. It's easier in a research way to do that than I think at the government level to do that, because they're just so busy and money is siloed into each department. But that would be, yeah, one potential.
Yeah, no, I agree. I think one of the big problems that we face is that they usually think from their sectors, but when you talk about climate change and its impacts, it's going to have a more holistic impact. So you cannot only think on transport, you cannot only think of energy. It's actually a combination of that. So the challenge is how people working in local authorities can talk with these different sectors and propose actions that everybody is part of.
We do have a question online from UNO Padilla, who says, thank you for your talks. For both speakers, what do you think the next steps are based on your results?
Well, I think the next steps, it will depend on each area. So for example, in Brazil, we have a gap because a lot of places don't even have these documents. So the next step there will be elaborate these documents and understand what actions can be done. And maybe for Southwest of England, try to understand which are the main gaps here. So for example, there's a lack on topics related to vulnerability. So maybe this is something that can explore a little bit more on their actions.
So for me, my next steps is on the communication side of things. So I've been testing different ways of communicating climate projections in workshops in different countries in Southern Africa to try and understand what people understand, because, you know, those maps I showed and the box plots that are often shared are still shared to these kind of, you know, users or people who are trying to plan, and they're not always, well, they're quite often not understood in that format. So testing them, because in a research project, you often run out of time to really think about how you communicate it, because you're trying to get all the science done. So that's kind of my next steps. Yeah.
Yeah, no, it's good to hear that. Yeah, thanks for both the talks, Ailish. I was interested in that, and you know, I agree. You're saying, you know, it's important to use a good set of models and scenarios that someone to represent the uncertainty. But the flip side of that is it becomes quite hard for users who aren't, or other scientists actually don't deal with climate data. And I was just interested, have you seen good evidence in the sort of work you've been doing, reviewing the strategies and things of that being good examples of the user side drawing down uncertainty and using it in decision making? Because I think often as well we kind of come of it at it from a angle of this data we've got, you know.
Yeah.
Yeah.
So from the user side, actually, when I asked them in the interviews about uncertainty, they would talk about something completely different because everyone has their own uncertainty. If you're in finance, if you're in health, if you're in decision making, uncertainty means different things. So when I was talking at the start, I was like, okay, not everyone's a climate scientist, I'm talking about climate uncertainty. And where they were able to speak a bit more about how they actually use the information were when they were in a climate adaptation role in government quite high up, and they were working really closely with the universities, and so they were able to ask them questions, and so it was, I suppose those connections had happened a few years ago and it was sustained and there was trust and they could feel like they could go. There's a little climate and weather committee in one country and they go and meet with the government. I think maybe once every 3 months, but more frequently in the rainfall season, and they talk everything through. So they're probably the examples, and that's why I was going on about preparation and processes and being in the room and interacting. So yeah.
I have a question for Leticia. I'm coming from more the health side, and a lot of the time we're really worried about selection bias. So like in our data, we improve our mental health. So a lot of people, if they have really extreme mental health or whatever, they would drop out of the study. So then your health data becomes very unrepresentative. So you could potentially be not finding like important associations. So I was wondering, like, is there like how are you recruiting your, like, I guess for the health data, are you trying to just invite people to the data to try and link the relationship between climate change and health, or are you like, I guess, having every data from everyone?
Well, for the document analysis, actually, I just selected the climate action plans are available for everyone. So I just selected the ones that we would use for each one of the areas. I didn't really need to recruit them. But then to prevent the risk of bias, I have another researcher also coding some documents with me so we can see if we were getting the same results.
So like for multiple health outcomes, I think.
Yeah, because then we basically just analyzed the climate documents. We weren't like thinking, okay, which are the main health outcomes they're talking about, if they are like mental health or heat strokes or things related to that. We are just trying to understand how health was discussed. So if they focus more on transport, natural resources, water, waste.
Another question for Leticia, but thanks to both of you for your presentations. I was wondering about the sort of quality of the engagement between the two regions, so Southwest England and Brazil. So not just, counting the number of documents that relate to housing or health or whatever, but how that engagement occurs. So by the sound of it, you're coding up the documents. So you're looking at the nature of the argument, the scope of the debate on those issues, or are you leaving it at just kind of whether they're addressed or not?
Just whether they were addressed or not. This was like the main focus of the study, to check if they discuss or not discuss.
Right. So in terms of the quality of the discussion, that's another project.
Yes, yeah, that would be another project, yes.
Yeah, I guess maybe just to follow up on that, I don't know the scope of your PhD, but it would be really interesting from our perspective to understand more about the role of the kind of climate risk assessment and whether that kind of feeds through into those policy documents, because I know like both Brazil and the UK have I think good but different ways of like assessing climate risk, and we've been thinking about like a little bit the comparison between the Southern African countries where within Southern Africa there's like differences in terms of the amount of activity that's going on around assessing climate risk, but it's then if you think about like the UK climate change risk assessment, it's like another level. So if you compare say like the national communication from the UK with the ones that Ailish was analysing in Southern Africa, like the way that they deal with the climate projections is quite different. So yeah, will be quite interesting.
Thank you. That's something that I can think about.
Question for you, Ailish. I wonder if through your research you have identified any ways to simplify the complex data modelling that you're trying to communicate to audiences who maybe don't have the scientific literacy to be able to engage, so that they can use them effectively in the development of policy documents and recommendations.
So one thing we will probably be looking at further is this idea of storylines. So broadly, you look at different plausible futures, and by that I mean, if you remember that graph and there was lots of the dots, you might say, okay, well, for the Southern African region, it might get hotter and drier, it may get hotter and wetter, it could really be variable and also still get hotter. The temperature bit we're okay with, but the precipitation is harder. And then communicate these storylines in that way. And so one of the national communications does do that, the South African one, and try and communicate that way. What some of the early evidence we have when I've tested this is that they might pick one that they think they like the most, or they think will be the most likely one, because there's no probabilities assigned to them. But yeah, that's something that we're going to continue looking at, because although it's not perfect, it's potentially better than the graphs and the maps that people maybe really don't understand. And then also from those storylines, you might be able to see what options would be a good option across all three, and do it with a bit more confidence maybe. So yeah.
It's really interesting, thank you.
Can I follow up question on that, Ailish? That graph you showed before with all the models by month,
Yes.
as far as I remember, kind of January, February, March, the beginning of the year, all the models seem to show that it was going to get drier. Some a lot drier, is that right? And some less. But the middle of the year, that's where the real variation occurred. Am I remembering?
So it started in June. So maybe
Okay, maybe there.
yeah.
But I'm wondering whether the key difference is, for some months, the models are broadly in agreement that it's either getting worse or worse. But then in the other slice of the year, actually, that's where the really significant difference is. And I was kind of wondering why. I mean, I'm not a kind of climatologist or anything like that, but I was wondering why some months do you get those? Can you? I know it's someone else's work, but can
It's
you?
okay. Alan is online and Rachel is here. So, but broadly, so June, July, August is the drier period, historically and probably in the future. And then when you saw all the variation, that was the rainfall period in the region. So some kind of from November to March-ish time is when the rainfall comes. And so there's a lot of variation on if the onset will change and if it will get drier or wetter in that period, or it may be previously it would rain somewhat consistently through the period, but it may be very heavy rain, then a bit of a dry spell, and then heavier rain. And that's a big problem because of rain-fed agriculture in the region. Knowing what will happen in that time period is really important. But I will let Alan and Rachel add to that if they would like to.
That's a great explanation.
I was wondering also, are they absolute figures or are they relative to the rainfall for the month?
Alan, you can't remember.
But the kind of shape of the graph will look similar if we use absolutes or relative. Oh yeah, this is absolute, so it's in millimeters per day.
Okay.
But yeah, maybe I could just add that, yeah, I think that although the models agree for the dry season will get wetter,
Yeah.
we're not super interested in that because many of the models are anyway too wet during that. It's meant to be that there's basically no rain at the beginning of this plot, and then they get dry in future, and that's kind of associated with this like large scale response we expect to climate change, that the sort of I don't know how to explain, like the expansion of the Hadley circulation and basically the tropics expanding and leading to like more drying, I think. But we haven't really looked into it so much. What we're looking more into is the onset. So like if you look at the S and O, September, October, there you see again, that's normally when the rainfall season starts. And then again, lots of models agree that it will get drier. And there's some research going on that we're looking at, but also from a group in Oxford and Cape Town that suggests some plausible mechanisms for that. So we kind of dig into that more, and that's what Alan's doing at the moment to try and understand, like, is this something that we can have more confidence about that's worth communicating
presumably that if it's a dry month anyway, a few millimeters per day less is actually a lot relative to the average month's rainfall. Do you see what I mean?
Yeah.
Whereas in the wet
Yeah,
months, actually, so it's kind of distorting the relative effects, isn't it? By the way, it's an absolute figure. I'm not.
Yeah, we normally try and look at it both ways. Yeah. So you look at the absolute and then you look at the relative change as well, because they have sort of different implications for impacts.
Yeah. It's a great point you've raised, because when I've spoken to people, some people are like, we want the relative, and then other people we want the absolute. It just depends, everyone has a different preference. So it's quite hard to know how to communicate, because it really is a personal thing.
Any final questions, either from the room?
I had another question about models. Of those different countries that you're looking at, how many are using the same models, or are they all using different model sources?
So I can't remember off the top of my head, but there is a table in the paper, and it shows you how many models and the models' names listed where they have them. So I think about 9 of them do have the number and the name. Some of them they don't state how many or the names of them, but yeah, you can go and have a look, and I believe that some of the models have these biases, and I can't quite remember which ones, but yes, it's in that.
So it's interesting to think about neighbouring countries if they're using different models.
Yeah, I think
and then what that impact has on regions that kind of cross over. So drier regions that may cross over, or agricultural regions that may cross over.
Yeah, I'm not sure. I know there's like the summer, so the southern hemisphere summer rainfall season maybe would use a different one, but I actually don't know if they do. It's not something I know.
Thank you. Are there any final questions from our online attendees? Not, I might invite everyone to give a round of applause to our speakers for a fantastic